So, good morning, everyone. As of now, we have 2,304 positive cases, 609 people under mandatory quarantine, a total increase today of 9 positive cases. Among those new positives, we know 3 are healthcare workers and 2 reported traveling out of state. 2 had close contact with a positive case, and 1 did not have a clear source of infection, which are running down. 1 positive person was linked to Hudson Park, so that brings that total number up to 47. There are 33 active cases in Albany County. There are 7,772 people who've completed quarantine, and of those, 2,271 tested positive for the virus and have recovered. That's an increase of 4 recoveries. The good news is our hospitalization rate's down, and listen, can't explain this, but I know our numbers kind of had an uptick from the Hudson Avenue party and other things. They went up north a little bit, but our hospitalization rate is the lowest it's been since the beginning of this. I believe 143 days ago, so almost 6 months ago. And the hospitalization rate is right now we have 1 person in the hospital with a hospitalization rate of 0.04. that have tested positive. The rate yesterday was the same, and there's currently no one in the ICU. And then we have a 5-day average of 8.6 new positive cases. Yesterday it was 10.8. So all good stuff. Can't explain it. Listen, this is we listen to the governor for guidance every day through the CDC, through the federal government, through the president, and we wait to see the guidance we have moving forward. Right now, it's still there. I know it's not affecting it the same way it affected us 6 months ago, but it's still out there in the community, and we still have to worry about this. Yesterday, we learned of a positive case in North Colony Central School District. An employee in the extended school year program tested positive for the COVID-19. Our Department of Health, led by Dr. Whalen, worked closely to identify the employee's contacts, and the school's conducting a case investigation with our EPI and everyone else. Dr. Whalen's team shut the school down today. They're going to be doing deep cleaning and basically brought the Department of Health in to really go through it and see if this got spread or if it was just isolated to 1 person. But who better than to talk about that than Dr. Whalen?
Thank you, County Executive McCoy. So we did learn of 1 positive case at the in the North Colony School District at a program that's housed at Shaker High School. And I would like to say that Superintendent Joe Core has been incredibly proactive, and we worked a lot over the weekend about making sure that there was appropriate messaging to the parents and that we identified all contacts of the individual. It was out of an abundance of caution that the school was closed today, and we have worked to identify upwards of about around 19 contacts, and we have worked with the state DOH to facilitate testing for those individuals today, which will be expedited testing. So I want to reassure the public that this has been a matter that has been comprehensively addressed by both the school district and the Albany County Department of Health, and we look forward to sharing more information with you as it's available. But I think at this point everything has been done appropriately to notify both parents of the district, staff at the school, and contacts. I do want to say, and not necessarily related to this particular incident, but with other cases that we've experienced recently, we are getting pushback from people. Not with this case, it's completely unrelated. If you get a call from the health department, if you are identified as a contact to a case, this is a serious thing, and with it comes a legal quarantine. If you decide you are going to hang up on my staff, if you decide that you are going to be difficult, the next step will be to have law enforcement on your door. So please take this seriously. We are working in the interest of public health. We are working to stem the spread of this disease, and the best way that we can do that is to trace contacts of cases and to make sure that they are appropriately quarantined and that they are tested. We want to help you, so please know how important this cooperation is. Again, the cases that I'm referencing to have nothing to do with the North Colony School, but this is becoming an increasingly difficult situation for our staff to work with. And I think that, you know, the members of Albany County, the citizens of Albany County, need to continue to know that it's important to toe the line through this difficult time. We all need to work together to enable us to be able to do things like open up schools and move forward.
Thank you, Liza. You know, and as the governor makes his decision this week of how schools are going to open up, it is important. You know, we can take what happened here at this camp, and we can learn from it, and we can learn how we're going to move forward addressing this, because it's going to happen. It's going to happen in the fall. It's going to happen at a school district. They're going to do everything they can to protect our kids. So that's why we say to parents that if you don't want your children going to a setting, you know, set up where you can do the Zoom schooling and you can do distance learning from home, and obviously until we get a vaccine to move forward. And, you know, and talk about, I know it's a different world out there. I know people were pretty much in the house for 14 weeks. I know it's going to be 6 months, believe it or not, next year. And it's tough. And I said, you know, don't get into confrontations with people when they fight you about a mask or they don't like something that you said. I know I've taken a lot of criticism from a lot of travel basketball teams. I'm not going to call you out. You know who you are, and look, if I got to be your punching bag, so be it. We follow the rules from the governors, from what he puts out through the control rooms, and obviously the governor's trying to do a job where he protects everyone, and we don't end up being where we got to shut down again about travel outside the state, well alone in the county. We can only put it out there. It's guidance. Dr. Whalen and I can say how many times, wear your mask properly, cough into your arm, wash your hands, stay 6 feet apart. You know, but then when I drive home and, you know, I know people are back to normalcy. People are back on swing sets, playing basketball outside, playing kickball, and doing their thing. All we can just tell you is this isn't done with us, and thank God. I say this, thank God that it's not affecting people like it did 6 months ago, where it was putting people in a hospital and ICU beds. But let's not forget, I think the 29th of July, we had 2 people pass away. You know, so it's still there. It's still affecting people, and that's why we identified that group from 20 to 29 to watch that, because they are spreading it to people that have underlying health issues, and thank goodness it hasn't addressed anything differently. I've been very careful myself. My staff in the beginning, we broke it down into 3 elements. We moved people around, so if I got sick, then my deputy Dan Lynch would take over. Had my counsel work in a different location, and had other people around the county work in different locations. For that reason, you know, that's why I put Chris Quinn at one location, Dan Lynch at one location, and Mike McLaughlin at another. And I said that from the beginning. You got to be ready for the long game. I said it's a marathon, not a sprint. I can assure everyone out there, I usually get tested. We keep a nucleus of people who are in our office, who's allowed on our office. A lot of good guidance from Liza on wearing masks in the offices and stuff like that. And I know I jokingly said I didn't understand when people wear a mask when they're by themselves, and I did take some criticism, and they were correct. There are people that are picking up sick family members with underlying health issues, and they're doing the right thing. I more or less was kind of joking, because my oldest daughter always drives around with her mask on, and I asked her that question, kidding around, but it happens. But I stay in the nucleus of people. So when I got tested, been negative every time, but I did do the antibodies, and I had it. So I had the COVID back in December, January. They put the timetable down before it even broke here, before we even knew about it, when I was traveling with County Executives of America and traveling with the military all through Texas. So I got it somewhere along the line in that time frame, and I know when I was sick. But it doesn't mean I can't get it again. It doesn't mean I have antibodies against it. It just means that I had it once and got through it. Scary, because I didn't know what I was dealing with at the time, but I knew the fact where I was really sick. So I am cautious, and you know, it's tough. Same thing I had to tell my daughter, who was going to get married May 28th, and then August, now the 3rd of October, and it's going to be under 50 people, because that's what the governor said. It's going to be a small little wedding. She did a drive-by shower, And, the ironic thing is, I know I'm part of the public eye. There was a gentleman taking pictures of me, yelling about social distancing and giving me a hard time. I can assure you I was a laborer that day. I was going to call Anthony Facina up and join Local 190 because I had explained to my wife, I am the county executive. Why am I moving tables and chairs and laboring all day? She reminded me I'm her husband. And that was my daughter. So I spent the day moving, didn't stay a day at the party, and it was a drive-by, and just a few select people stayed in the backyard, social distance, because I can assure you they set the tables up that way, and another party that was there. So I can assure you I'm cautious who I drive with, who I'm around, and what I do. But again, you have to lead by example. And you have to show people that you're willing to do it. And I wear my mask all the time at a function, and if I don't want to, I leave. If I think they're not doing the right thing, I tell people that, and it's up to them. Like I said, the restaurants I've been at, I've got up, put the mask on, and they try. People are really trying, and we need to support local businesses and restaurants and bars and shops and the mom and pop shops because they are the backbone of our community. But again, we're in this together, and I want to say everyone handles things differently. Everyone does. I have this gentleman give me finger gestures every morning, and I just wave nicely, and I get it. I get it. The world's different. Everyone handles things differently, but that's why we established, and right away, I established the mental health hotline. And I did the mental health hotline for that reason. And I learned that from being in the military, that, it's one of the things even our tag now, General Shields, puts out all the time. Mental health is there. Everyone handles things differently. The same thing, I will say, please, if you have an issue with your mental health and things are bothering you, listen, people are there to help you. And again, people handle stress differently. Some have a high tolerance, some have a low tolerance. The world is different. Things are different. No one's perfect. So I will say this. I will apologize to everyone listening to this and watching this. I'm not perfect. I make a lot of mistakes. I'm human. So I will say sorry, but I'm trying. It's been a long 124 days, 6 months. My staff hasn't had any time off, around 7 days a week. It's been tiresome, and I'm dealing with the economy and on top of a health crisis. And that's okay. That's what I signed up for. So I'm not complaining, but please understand that. But if you have a mental health issue or something is really bothering you, please, by all means, I mean this, reach out. They're there 7 days a week from 8 a.m. to 5 p.m. Area code 518-269-6634. Please call. Just call. The world is different. I know you're nervous. I know you're scared. I know things you don't like. You don't like rules. No one likes rules. It's a free country. I get it. But I can assure you, as much as a lot of people think the governor likes being a dictator, he doesn't. He's just trying to do the right thing. And when you put your head on your pillow at the end of the day, you hope every decision you made was a decision that didn't cost someone their lives. And you made the right decision. And it's tough when you go to sleep at night, trust me, thinking that, did I cross every T, did I dot an I, did I make every right decision? Because I can assure you, being president of County Executives America, being president of NISAC, being a county executive here, the decisions I have to make every day, I go to bed saying, please, God, please, hopefully I did the right thing. I did the right thing. And I'm not. There's not every decision that I made the right decision. Stuttered a lot. Say words wrong. Certain people love it. They enjoy it. Good. I'm your punching bag. If I put a smile on your face, that's what it's about. That's what it's about. Laughter gets us through the day, So please, by all means, keep that going. I do want to remind people, please go and get tested. It's free. The state doesn't pay for anything, doesn't make you pay. We don't make you pay with the mobile testing, but the state university is always 1-888-364-3065. And by appointment for our mobile testing sites, area code 518-465-4771. Our Rite Aid in Colony. As always, go online. Priority 1 in Gilliland, that's where I got my antibody testing done with my test, so they do a great job. 518-867-8040. And just remember the 4 things Dr. Whalen tells you. It's going to be like the Dr. Whalen thing. We should just do a poster with that. Wear your mask right, cough into your arm, clean your hands. and try to stay 6 feet apart. And again, the 24-hour sexual assault hotline is 518-447-7716, or the New York State hotline, as always, in the 211. So again, thank you everyone for doing the right thing. We're getting through this. I know it's tiresome. I know it's been almost a half a year. It'll be 6 months. August 12th, I believe, right? Was our first one. August 12th will be 6 months next week. Did I think I'd be sitting here 6 months later? Heck no. I'd like to use another word, but no. But again, we're in this together and we'll get through it.